Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine. The topic today of my health talk is recent updates on flu viral illnesses during winter 2023 and 2024, and also I will comment on what are the proper vaccines that are needed for this. There has been a sustained increase nationwide among children who are suffering from flu viral illnesses. During the fall and winter months, there have been more incidents of common cold, allergies, flu cases among the children. And this is mostly because the kids are unable to acclimatize to the weather change. So a fewer regular checkups by pediatricians during COVID era, uninsured parents and caretakers due to the loss of job and missing regular immunization updates. So now I have described the three kinds of viruses that are affecting our children as well as the adolescent going to the schools, colleges, and during the whole winter. It is continuing towards the spring. Influenza is the most common virus that affects all the individuals. The influenza viruses, they start from early fall, they linger through the winter and also to the spring. Another one interesting was COVID-19. We already passed through the COVID era, the post-COVID era, the Omicron, and different kinds of genetic mutation of the COVID. And I don't want to go through all the details about the COVID. And the new virus that we are facing these days is called RSV, respiratory syncytial virus. Next slide, please. So first of all, what is flu? Flu is extremely contagious, and the symptoms are almost same like a common cold, sneezing, sore throat. Usually the symptoms of flu subside 3 to 5 days. Symptoms of persistent fever, chills, muscle aches, productive cough, trouble breathing. These are examples of more serious viral illnesses. A recent survey by the CDC have revealed that 780,000 people who are sick with flu so far this season, resulting in hospitalization due to complications and flu. This is according to the recent CDC write-up. So first of all, what is COVID-19? Like I said before, the COVID-19, that is a disease caused by SARS-CoV-2 virus. This virus specifically targets the lungs. This is a new target of the virus that can affect the lungs. So the virus affects the lungs and leads to the symptom. They are similar to flu or pneumonia. The SARS also mutate very quickly and presents a different variant. There are different variants of the SARS virus, and that includes Omicron, Delta, and Alpha. The total number of COVID cases are getting less nowadays due to a proper immunization and specific early detection. However, a recent data from the wastewater scan, a group that receives data from the wastewater collection sites in 36 states, they are looking for this another variant of this COVID viruses that remain dormant in the sewage area, and later on they become more active and affects the individual. Again, the bibliography has been included for that. Next slide, please. So now, basically, I'm talking about the RSV virus, which is respiratory syncytial virus, which is a highly contagious respiratory disease. Most of the kids with the RSV, the symptoms are same like flu: stuffy nose, cough, wheezing, but only the severe cases of the RSV, once they affect the lungs, leads to bronchitis, pneumonia. Infants and the immunocompromised individuals are more at risk for developing a severe case of RSV. Now, this year, the RSV virus, it hit earlier, late fall and early winter. Usually the typical peak is around January and February, and mostly it is because of due to lack of vaccinations. The lack of vaccination may stem from heightened stigma, the anti-vaccine ideologies that is surrounding vaccines during post-COVID era. Next slide, please. So what is the virus? I draw a picture of this, which is a common respiratory illness: cough, sneezing, running nose, decrease in appetite, fever. Persistent of these symptoms beyond 3-4 days makes somebody think about reaching at the diagnosis of respiratory syncytial virus, also called the RSV virus. Next slide, please. So there are two kinds of immunity in the body that I like to touch the base on: the innate immunity versus adaptive immunity. To discuss the vaccines, we must first understand how vaccinations and immunization work together. Human beings have two kinds of immune system organization: the innate immunity and the adaptive immunity. The innate immunity, it refers to a physical barrier that prevents the pathogens from infecting the body. The physical barriers are such as skin, mucus, lysozymes, and the antibodies. Children are born with innate immunity reflective of their mother, who provide antibodies initially in the babies through breastfeeding. The adaptive immunity is different. It refers to the immune response to a specific antigen that gets past the first line of barrier, and this is the basis of the vaccination, the vaccines that are being prepared. Just as the name suggests, the immune system can learn to recognize these specific antigens, and these are markers to a particular pathogens, and they utilize this information, the specific antigens, to synthesize the antibodies against that foreign invader, and they store the information during the later part of infection. In other words, the adaptive immunity, it is surface antigen based. When the virus particles goes to the surface of the surface of the lungs, mucosa, then they produce the target and immunity. These vaccines are supposed to utilize those particular surface, specific antigens, and mark the antibodies that will specifically go through the same genetic variation of the virus. Next slide, please. So this is in other words, this is a very simple diagram to show the innate immunity: neutrophils, macrophages, dendritic cell, and T cell. The adaptive immunity involves the beta cells, the natural killer T cells, and the T cell. And these are the T cells that produce the produce the vaccine. They produce the antibodies to that particular virus. Next slide, please. So the vaccines, they do take the advantage of adaptive immune system, and they provide a safe way to grant immunity. The vaccines contain mostly the dead, inactivated, or genetic material of the virus cell or the pathogen. The vaccines now, for our viewers to know, the vaccines only contain a tiny fraction of the pathogen, which is enough to produce an adaptive immune system in the body to make it like an antigen. It synthesizes the antibodies and it stores specific information in the form of memory beta cells. Vaccination allows us the opportunity to avoid exposures to the live viruses, giving us a much safe alternative to generate immunity against several pathogens. Modern technologies have since advanced, and improved vaccination are most effective against a wide variety of diseases and the infections. Next slide, please. So following are the routine vaccines administration to the children according to the American Academy of Pediatrics and the CDC guidelines for 2023-2024. Influenza recommended vaccines: H flu type B, 2 months old; influenza quadrivalent vaccine; annual flu vaccine. COVID-19 is COVID mRNA once, and that is an updated vaccine for 2023-2024. RSV recommended vaccines are RSV, Abrasivo, and they are usually given to the pregnant women before birth. RSV-MAB, this is called NIRSV-MAB vaccine, given to the mother or infant, that is postpartum, depending upon the immunization. It is recommended that all individuals receive and stay up to date with their vaccination. This is not for personal safety, but also for the safety of our communities and those who are at most risk people, such as children with immunocompromised individuals, serious complications due to infection of the pathogens. So now, it is recommended all receive and stay up to date. So bottom line is, in short, I have talked about the vaccinations in general, and I have given the bibliographies where my information have been obtained, and I do recommend everybody to be up to date for their vaccinations in order to prevent them from the diseases. Thank you so much. I'd like to thank our camera crews for helping me produce these videos about the vaccination for respiratory syncytial viruses. Thank you again.